from the UK, but you transplanted yourself over to Memphis. You were a former Director General of the NHS, I believe.
That's right, the Department of Health. In fact, I'm from Birmingham. We should get a shout out.
No way! You're home. You are home.
Exactly.
That's great.
Exactly.
Okay, but you work now in the US. Tell us, how those two healthcare systems are similar and differ.
They're similar in some ways. So the quality of services is pretty much the same, Emma. Doctors and nurses are trained in pretty much the same way. What's really very different, though, and very significant for us in the US, is that people don't have access to universal care. And that's a real problem. So the clinics we run in a pretty poor part of the United States, in fact, in Memphis, Tennessee, 90% of the people we see in our clinics don't have insurance. And what that means is they come with two concerns, two fears. Now, you should only ever go to your doctor with one fear, and that fear is about the illness you're experiencing, right? Mm-hmm. And we see patients who have the additional fear of, can I pay?
Not being able to pay, yeah. I remember when I lived in America, someone said to me when I was just there, you don't want to get sick here.
No,
because it's so expensive.
It is expensive, the quality of care is really, really good, but if you're poor, if you're on the margins, then it's really difficult to access sometimes. But really, what's really the same is the three big challenges we're facing both sides of the Atlantic. The three big challenges for us in the healthcare system globally, I think, are one to do with cost. In the United Kingdom, we spend almost 10 pence in every pound on healthcare. In the United States, we spend almost 18 cents in every dollar, so almost twice as much, right, which is crazy. The second big problem beyond cost is chronic disease. Most clinical colleagues now will tell you that there's been a significant rise in the amount of chronic disease that people are seeing. And the final issue is that healthcare has become illness care. And so I think to transform healthcare, you have to transform health. And I think Juice Plus has a part to play in all of those issues, reducing cost, reconnecting healthcare to health, and putting people back in control of their lives.
Because it's that whole concept of not waiting till you're sick.
That's exactly right.
Solidifying or emboldening your health.
That's right.
Yeah.
Yes, there's a great public health consultant called Michael Marmot, who's from the UK, works with WHO, and he talks a lot about agency and control. How do we take control of our own lives? How do we make good life choices? And he says that's predicated on one very important factor, and that's great life opportunities. Great life opportunities result in great life choices. And I think Juice Plus has proved itself to be a great life opportunity.
I know, I see it in Ireland. We suffered, as the whole world did, an economic recession. Yeah. And, I've been working in the nutrition industry nearly 2 decades, and I've never seen people more aware of preventative health and how important it is, because I think during the recession, one of the good things that came out of it was people weren't taking their health for granted, because it meant if they were sick, they couldn't work, they didn't earn any money, they couldn't afford private health insurance, they couldn't afford to get sick. So people were starting to really understand the importance of diet and exercise and preventative health in a role of keeping costs down. Do you see that, Nigel and Jeff, in your clinical practices?
I see it a lot. I mean, in fact, I'm maybe privileged in a way, because part of the people who come to see me are being proactive about their wellness, so they come for prevention, and it's very heartening to see that, because in conventional medicine, as a doctor, we're used to seeing people who are sick, and they come when they're ill, and this is where I feel there needs to be a paradigm shift. If we're really going to make an impact on disease in the future, we need to look at we need to empower people, first of all, to the knowledge of what they need to do to prevent those sicknesses, so they don't need the services of conventional doctors and conventional medicines. And of course, we all know from what we've discussed that phytonutrition, Juice Plus, fits beautifully into that scenario. Because of all the things we've discussed, it empowers our cellular health, prevents disease. We can't say that, of course, we can't make that claim, but we all know it does that.
But we do have the evidence for 35 published on PubMed studies, so that we can use that information quite effectively. Jeff, in your practice, you see how does the evidence and the security that you have as a healthcare professional help you when you're talking about nutrition and Juice Plus in particular with your patients?
Well, I think discussing the healthcare of the patients, I mean, what attracted me back to Juice Plus was the very strong clinical evidence base that the company have have given us as clinicians. You know, we know that food is medicine, and we know from certainly the characterization study that Nigel was talking about yesterday, that we have food in a capsule and it's high quality phytonutrients that are in there. So increasingly as clinicians, we're called to work with a strong evidence base, and with this one product, we can very confidently give that to our patients and point them to the research and help them to understand that this is an evidence-based product. And then from the anecdotal standpoint as a clinician, the measurements we take in the clinic, we use regulation thermometry and bioresonance scanning through the meridians. We're seeing increasing toxicity and a burden on the lymphatic system and the liver, the biliary system. And what I can say is very unscientific. I can say that when we give our patients this foundational product, we see changes in those systems. So we have, anecdotal evidence that the food components that are in those capsules do what food does.
But the reality is, we're probably only scratching the surface when it comes to all of the different effects and positive effects that Juice Plus can have before we actually have the research to back it up. Mark, I want to bring you in now as well, because it's interesting what Anthony and Nigel and Jeff were both saying, that there's a paradigm shift. When you think about the World Health Organization, their definition of health used to be a lack of disease. Now it's not merely an absence of disease, it is a physical, social and mental well-being. So it's more than just not being sick. And when it comes to research, traditionally in pharmaceutical research, it was always looking at the lack of disease or the lack of symptoms or the amelioration of them. But now you're seeing with your work with the CRN that there has to be a change in thinking when it comes to what you're looking at in terms of markers of health.
Yeah, I gave a talk in Frankfurt in November as part of the CRNI conference that John and I helped to underwrite.
So just tell the audience what the CRN is, just in case.
CRN is Council for Responsible Nutrition. We have an international division based in Switzerland. The members are the biggest and the best and the most esteemed participants in the dietary supplement industry in North America and now globally. And we held a symposium in conjunction with the Codex Committee on Nutritional Foods for Special Dietary Uses. It was held in Bad Soden in November. And I was asked to open the conference talking about this paradigm shift, that we have to stop looking at research in the pharma model of research when it comes to natural products. And if we keep doing the same thing over and over again, expecting a different result, that's the definition of insanity.
Right.
So why don't we take a more holistic view to the human being who is being administered substances like Juice Plus, and look at a wide array of biomarkers within the human that we can identify in the blood, in body tissues, etc., and start publishing that data. Because the very first research that John was alluding to, that we did at University of California in Los Angeles, 20 plus years ago, we took healthy people, we gave them Juice Plus. We took their blood studies on day one, and we saw something very interesting, that many of these apparently healthy young people had high levels of serum lipid peroxides. In English, that means they had rancidity in the fats in their blood. Is that right, John? Is that right, Manfred? After, 60 days of taking Juice Plus? After 28 days, those people did no longer have high levels of serum lipid peroxides. They still looked the same. They looked healthy. They're young, active, just like many of you in this audience. They didn't even know that they were at risk for certain things like cardiovascular disease.
Right.
Because clinically, unless you presented yourself to a physician and said, I'm not feeling well, there'd be no reason to do the investigation.
Right.
So it cycles back to something very fundamental about Juice Plus. Juice Plus is kind of like the living standard that Hippocrates should have had when he made his statement, let your food be your medicine. It's as simple as that.
Yeah.